Understanding. Shoulder. Labrum tears.
Okay, talking about the labrum in the shoulder. I've been getting actually a couple questions about labral tears and how to actually fix them and what they are and when you may need to actually go to have surgery. First and foremost, the labrum is a band of tissue that sits around the socket of the shoulder, or the glenoid, right here. You'll notice it's a very shallow socket, okay? It's a shallow socket, it's a more unstable joint. So you trade the mobility of the shoulder, because it's one of our most mobile joints, but you take away some of its intrinsic stability. So instead of having a deep socket like our hip, what you have is a more shallow socket that comes off of the scapula. And that it deepens it by taking a more collagenous, ligamentous type of tissue that can stretch a little bit. Now, labrum tears can come from a couple different things. One is traumatic, and you know that you did it. And more often than not, you get a labrum tear because of a full kind of like over-hyper, I would say, external rotation, because that joint kind of moves itself forward and then it pushes up against that labrum. And it basically, just like spraining your ankle, blows through that labrum. But mostly it could be repetitive throwing stuff that will do it, because it'll push that head of that humerus forward into that labrum. Or it can be degenerative, and more often than not, they're degenerative. And that's really what we want to know, because absent of an actual trauma, how do these things occur? Because if you know how they occur, you can at least minimize how much they continue to pick at that labrum. So most labral tears start at the front part of that shoulder. And what can happen is this joint, the glenohumeral joint, it doesn't just hinge in one spot. It actually has a roll as well as a glide. So the head of the humerus, actually, when you go to lift your arm up, glides back and down, okay? Now, what can happen is the head of the humerus actually gets stuck in its forward position and it can't come back. If it can't come back, it pushes up against the front part of that labrum and starts to stretch it over and over and over. So when you go to lift your arm up, or if you go to lift it, kind of bring it out to the side, it's going to take that joint, because when the arm is kind of moving out to the side, it's going to push that shoulder, that head of the humerus a little bit further forward, and then that's going to push into the labrum. So the lack of this glenohumeral joint mobility, the restriction of this posterior glide, is actually what starts to do it. Now, that's happening locally. What else can happen? Lack of mobility of your acromioclavicular joint. That's this guy right up in here. Lack of that mobility will cause the shoulder to have to over-rotate in order to be able to make motion. So that joint can actually start to create problems, because the lack of that mobility will not let the scapula move the way it's supposed to, and therefore causes this shoulder to over-rotate and push into that labrum. And what's also interesting is the thoracic spine can actually do this, okay? And I can illustrate that for you. So that shoulder, again, is over-rotating and getting stuck in that anterior position, and the thoracic spine does this. So what you can notice is that when I completely flex my spine out, okay? So I've completely just dropped my shoulders and I go to lift my arm up, okay? This is as far as I go. Now, without moving my arm anymore and just returning back to neutral, this is all I can get, okay? Without my thoracic spine able to extend, then I can't get that last little bit. So your thoracic spine is actually, that last little bit of flexion actually comes from the thoracic spine extending. So if you don't have the extension here at this thoracic spine, you can't get that full flexion, which means this glenohumeral joint is going to have to over-rotate. So if you have a labral tear, you have to look at these things, because that's the etiology of the problem, absent of a trauma. It can be hypomobility of the glenohumeral joint, for which you do joint mobilizations. You can do mobilizations to the acromioclavicular joint, which will allow that scapula to move. But then also, you look at that thoracic spine. If there's a lack of mobility at that thoracic spine, then the shoulder, the most movable and most susceptible joint, is going to burn down. Now, the question is, when do you have surgery? That's kind of actually very difficult for me to tell people, mostly because it depends on the extent of the tear and also the placement. So if it is a smaller tear, but it's in a place where that head of the humerus often hits, it's going to be more painful. At a certain point, the extent of the tear is going to decrease the intrinsic stability. So the shoulder becomes less stable because it doesn't have that ligamentous support. And in my world, physical therapy world, it's always easier for me to make a tight joint loose than a loose joint tight. So then you would have to do stabilization exercises, rhythmic stabilization exercises, along with slow strengthening to rebuild that motor control and see how far you get with it. But at a certain point, unfortunately, that labrum just continues to degeneratively tear, and then it might be surgery time, especially if you're having difficulty with most of your just normal day-to-day activities. But effectively, that's what the labrum tears are. That's what the labrum does. And those are the things your therapist should be looking at in order to help make this better, not just exercising. Because if you're not, and I did a video on this with the whole mobility stuff with the rubber bands, is that if you're trying to just do mobility work at the shoulder without actually restoring this glide, you actually might be making it worse. And if you're not addressing these other things, you're definitely not doing the shoulder mechanics any sort of favors. So, yeah, that's the video for today. I would say take a look at my podcast, Around the Treatment Table with Jason, the PT, and make sure that you hit the like and the subscribe buttons, and or I think they might be over here. Yeah, and we'll see you at the next video.